So I'm going to hit record. And what we're going to do is get started. Many of you may be familiar with Good Morning America, and we just want to play a snippet here about our program to just give an overview.
Turn now to that GMA parenting alert about a free app a mother says helped save her baby's life by tracking how often she kicked. ABC's Diane Macedo is here with that story. What is this all about?
So this mother says that everything was completely normal in her pregnancy until one day, thanks to this app, she noticed that something was off. Well, it turns out her baby was in real trouble.
For Emily and Jeremy Ecoff and 2-year-old Liam,
Oh, nice.
life with their new baby Ruby is extra precious.
We have a healthy baby girl, and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the 3rd trimester.
It's just one of a growing number of apps helping parents through pregnancy and labor. For the Ecoffs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did, and when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes. So when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden, they came in and said, you're going to have an emergency C-section.
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
She sleeps about 23 hours a day.
4 weeks later, Ruby is now home, healthy, and sleeping like a baby.
Doesn't get much cuter than that. Now, the app was made in Iowa, which is where that family is from, but the creators say it's now spreading nationwide, thanks in part to Ruby. Since the news of her birth, the app has gained more than 5,000 new subscribers. So, Robin, the app saved Ruby, and by raising awareness, she may end up saving many more.
And we're hoping to do just that in Mississippi. So I just want to share with you some important talking points for our organization and for this conversation as we're trying to understand the impact of stillbirth in Mississippi. So these numbers that you see here were collected from the CDC Wonder database, and they're based on a 5-year average from 2017 to 2021. And so our program focuses on education and empowerment, and we believe that if we successfully implement this, we can save 30% of these babies that might otherwise be born stillbirth. So that's 121 babies per year in Mississippi. And I'm so grateful to be able to share with you. We had a Mississippi baby save last fall. This is Baby Save Callum. Callum's story is on our website, but I just want to share just a little snippet here from it. Kelsey is Callum's mom, and she said, I had an uncomplicated pregnancy and passed all of my prenatal testing. Baby Callum moved very early and quite often. In fact, he moved so much that it took several sessions to complete his anatomy scan. When I was around 21 weeks, my husband and I took a flight, and while they were traveling, she came across the Count the Kicks page while scrolling through Instagram. She says, I'd never heard of Count the Kicks or understood the significance of movement monitoring. I realized that baby Callum was not moving as much as usual, but I felt like I was maybe overreacting, and I subconsciously took this as a sign that I just needed to pay attention to my son's movements. So Kelsey saw her OB a few times between 21 and 26 weeks, and during her last visit, it was determined through testing that an emergency C-section was needed. She noticed a decrease in movement, and she kept telling her providers that she felt like something was wrong. And so they were looking to see what could be done, and they determined that she needed an emergency C-section. Callum was born at 26 weeks, weighing 1 pound, 12 ounces. He had an 80-day NICU stay, and there was a blood clot behind his placenta that was causing him distress. They determined that this was the root cause of his movement change. So Kelsey says that if I hadn't seen the Count the Kicks page, Callum wouldn't be here today. And so again, congratulations for getting the word out about Count the Kicks in Mississippi. It's always a pleasure for us to be able to share a baby that has been saved in a state where we're doing a webinar. And so today I'm really grateful to be able to share his story. I know Hybels has put the link in the chat if you're interested in more details about that. But just knowing is really the important piece of this. And that's what we hope you come away with today, is knowing how you can get the word out. So let's talk about how we can save more babies together. There are 3 important hallmarks of the Count the Kicks campaign. We provide education for expectant parents on the importance of fetal movement, and the campaign empowers those parents to speak up to providers if they have a concern. That's just what you heard in Kelsey's story. So the best news for you, if you're a provider, if you're a health department worker, doula, this campaign's ready to go. It's very easy to implement. So before we talk about implementation, let's just talk about stillbirth in general. And I want you to know, if this is triggering for you in any way, please feel free to leave the presentation. It will not offend us. We will send out the materials later for you to review if you feel like you're in a safer place to do that. So just know that we will talk about things that can be triggering for some individuals. So the likely causes and contributors to stillbirth, you can see some of them here. We also want to highlight and call special attention to syphilis. This is being diagnosed at unprecedented rates. It's kind of an older infection, but we're starting to see it have an impact on maternal and fetal outcomes at unprecedented rates. So during pregnancy, syphilis can spread from a mother to her unborn baby, causing congenital syphilis. If this is left untreated, congenital syphilis can increase the risk of having a stillbirth. So again, I said recently there's been this sharp increase in the number of babies born in the United States with syphilis. These rates are at the highest they've been in 70 years. And from the data, we know that 40% of babies born to women with untreated syphilis can be born stillborn or die from infection as a newborn. So we know that congenital syphilis can increase the risk of having a stillbirth if it is left untreated. So we want you to help us improve those birth outcomes and prevent syphilis-related stillbirths by talking to expectant parents about their risk and encouraging them to get tested at their first prenatal appointment. And just so you know, partners should also be tested. So this is definitely something to follow up with providers, but we want you to be aware of that link that we're seeing. So let's get a little bit into research and data. So Count the Kicks is based on a research study that was published in Norway in 2007. In the study, researchers worked with healthcare systems like birthing hospitals and OB clinics throughout Norway to educate expectant parents on getting to know what their baby's normal movement patterns were, and to know that they could speak up if they noticed a change. So we know from research that a change in baby's movements can be a red flag during pregnancy and often a precursor to stillbirth. These expectant parents were taught to alert their doctors when they noticed the decrease in fetal movement, so that the providers could investigate if a baby was in distress and take action or intervene if needed. So this systems change work in hospitals and OB clinics across Norway led to a 30% reduction in their stillbirth rate. And Dr. Ruth Fretz, you can see that she's circled there. She sits on our medical advisory board now. Our founders at Healthy Birthday saw this research and said, great campaign started in Iowa, let's try and replicate what they've done. And their opinion was, even if we save one baby, this will be worth it. So here's what happened in Iowa during the life of our campaign. So that red line that you see at the top, that represents the national stillbirth rate, and the teal dots and trend line beneath, that is our Iowa data. And that starts in 2003 and goes through 2020. You can see that our campaign started in 2008, it's noted there, and the trend line just starts decreasing from there. One important note is to see that the US rate has remained pretty stagnant, but Iowa's rate has continued to decrease. Now, we know that there can be outside factors and data can fluctuate, things like a pandemic, a syphilis outbreak. There's lots of factors, environmental, that may influence this rate. So it's really important to look at that data yearly and on an average. And so we'd like to highlight this as a reason why our campaign works. And you'll also note here, when we talk about disparities in a minute, throughout this trend, one other note we've seen is that the African American stillbirth rate has decreased by 39% in the first 5 years of our program. So that's significant, and we'd like to call that to your attention as we focus on health equity and impact. So we were recently published in the British Journal of Obstetrics and Gynecology in 2023. And this study showed that the stillbirth rate in Iowa went down 1% every 3 months for a decade, which is much faster than the other US rates. That told the researchers that something was happening in Iowa from, again, that time period of about 2008 to 2018. That was not going on across the rest of the United States. So researchers are now calling for urgent action to address the stillbirth crisis in the US because of the significant stillbirth rate reduction in Iowa. You can read more about our research by clicking on the QR codes on this slide. And there's another study there that talks about maternal anxiety. I'll reference that just a little bit later in our presentation. You're also welcome to read that research in AJOG. And then most recently, we have learned that our A1 pathway, there's a practice brief that has been published for this. This is great news for us. So A1 is the Association of Women's Health Obstetric and Neonatal Nurses, and this practice brief addresses decreased fetal movement. And this is the first time a nationally recognized medical organization has issued a comprehensive bulletin underscoring the crucial importance of fetal movement monitoring. This practice brief sheds light on various aspects of fetal movement, and it emphasizes the need for education during pregnancy and intervention. So the key components outlined here align seamlessly with our evidence-based stillbirth prevention program, which is Count the Kicks. And the brief states that focused assessment and management of decreased fetal movement or significant changes in fetal movement patterns by perinatal clinicians is essential for improved fetal outcomes. And I'll just make a little note here. If you're interested in what this brief says and how it ties to Count the Kicks, we actually will have a webinar coming up in about a week, and we'd be happy to send you information. I know my email is in the chat. Feel free to reach out to me for that, or scan that QR code to read the brief and be directed to more information. So I apologize. I have somewhat of a scratchy throat, so I'm going to need to take some hydration breaks during our presentation. So more research, anxiety. Let's just talk about that for a minute. The research that we've published in AJOG, and there are a couple other studies, show that there is no increase in anxiety among pregnant people when they're tracking movement, when they're using the app, when they are counting this movement. 84% of app users, the Count the Kick app users, stated that regular tracking was associated with feelings of bonding. So that's different than the anxiety. We love hearing about families that have taken time to count together and make that a practice. So that just increases that bonding experience. And again, I will be sending out a recording and a copy of these slides. So I will make sure that you have this research linked if you're somebody who wants to get into it. And we have a CEU opportunity as well that I can talk about it towards the end if you're interested in a little bit more of that. So let me highlight another Baby Save story for you. We love to share the information because it highlights just how important it is to provide education about fetal movement monitoring. So this is baby Abel. Baby Abel is from Washington. Christine, Abel's mom, decided to trust her intuition and contact medical providers when the fetal movement monitoring that she was doing was different than on previous days. So in her words, she said, "I never truly thought that such a drastic intervention would be needed. Please pay attention to your baby's movements and bother the heck out of your medical team if something seems off. I'm so grateful to all the nurses and doctors that got Abel out safely, and to Count the Kicks, and to those that share their Baby Safe stories." So at this point, I also want to pause for you and just ask if you to consider, it's not necessary to have this as a poll, but do you know someone who has endured a stillbirth? We want to highlight by asking this question, there are many expectant families who endure stillbirth, but this is not often discussed in preconception or prenatal care. The more that we shine a light on this devastation, the more we will be able to learn about preventing stillbirth. So that's one of the reasons why I ask you to consider that question today. So thinking about stillbirth by the numbers, I shared with you some of Mississippi specific data, but thinking about the United States, there are some considerations here. It's clear that there are vast differences in the stillbirth rate that affects Black, Indigenous, Native Hawaiian, and Pacific Islander communities. These differences exist, they persist, and they need to be addressed through systematic change. So one of the things that we're highlighted on is identifying racial disparities and connecting our work to what can be done to eliminate those disparities. So there's a large divide when it comes to those who are more likely to experience the stillbirth. And research has shown that there are some contributing factors. So systematic racism, we know, probably many of you on this call today, you know that our society fosters discrimination through mutual reinforcing systems, and looking at the social determinants of health, the housing, education, employment, perceptions of healthcare, access to healthcare, the criminal justice system, all of that can contribute to the systemic racism that persists. And then another one that I'd like to highlight for you today here is epigenetics. So this, I'm interested in this from a research perspective, that epigenetics explains how our early experiences, both positive and negative, can have lifelong impacts. And we can see that environmental influences can also affect the expression of genes, so that historical trauma can be present. Life experiences rearrange epigenetic markers that govern gene expression. And so this can change how and whether or not genes are releasing information. So that's one that's really kind of interesting to me. And we want to talk about more than just the stillbirth rates by race and ethnicity. We want to show you things that we can do to close the gap and how we center equity in our work. So let me share this video with you.
I am so blessed that she got here safely. And I'm so glad I listened to myself this time, and I listened to my body, and I counted my baby kicks. Count the kicks I mean, it helped. It really did. It saved my baby's life. It really did.
She was like, it's a good thing you came when you did, you know what I'm saying? Because if you wouldn't have, you know, we probably wouldn't be having the same outcome. I think about it every day, like, oh man, what if, you know, what if?
I just want to highlight again the importance of the support from the Mississippi State Department of Health. We're very grateful to have the opportunity, and you have an invested leader in Dr. Wilson. She's a great communicator and highlights the needs of the state. And so I'm really just want to shout that out. Dr. Wilson is fantastic to work with and has really pushed for this program to be available to the families in Mississippi. So what are we doing to reduce disparities in stillbirth? You can see there's a lot here listed, but we want to focus on the fact that we have developed culturally appropriate educational materials. We're working to expand languages that these materials are offered in. We're working to make sure that things are we take health literacy into consideration as we design those materials. And so we are trying to improve programming based on experiences that we hear about, especially from our families of color, that we are taking their concerns, we're taking their feedback seriously, and we're making changes in the way that we are coming into the communities with this program. So this time I'd love to highlight for you some opportunities, and we will do a giveaway. So if you, I think Hybels is going to put a link in the chat to the Mississippi store. These are materials, if you go to this web link, that you can order in the state of Mississippi. Now, if you are joining us from a different state, you're welcome to go to the store and look for opportunities in your state. But in the state of Mississippi, we have materials that are available in English and Spanish. We have app reminder cards, small app reminder cards. We have brochures. We also have additional free resources like printable kick counting charts. And I'm going to tell you about another opportunity. We have toolkits right after I give you this opportunity to order. So we're going to give away 2 Amazon gift cards. I'm going to play some music here, give you a time to get in there. If you've already ordered materials, I encourage you to download the Count the Kicks app as well.
It might seem crazy what I'm about to say. Sunshine, she's here, you can take a break. I'm a hot air balloon that could go to space. With the air, like I don't care, baby, by the way. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do. Here come bad news, talking this and that. Well, give me all you got and don't hold it back. Well, I should probably warn you, I'll be just fine. No offense to you, don't waste your time. Here's why. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do.
All right, I'm going to bring us back. Hopefully you've had an opportunity to look at some materials. If I keep playing that song, I promise I'll get up and start dancing. So we will move on so I can spare you that. So I mentioned toolkit. So this is an opportunity we'd like to share with you in Mississippi. Again, my email is how I'd like for you to connect with me on this. If you are interested in getting some materials of the campaign in this format, in a box that comes to you, it's basically advertising Count the Kicks, but giving you a couple different tools. So you see the wristbands that are there. Those are for rural health areas or for people who may not be able to use an app while they're counting. We do recognize that not everybody has access to technology. So this is an equity strategy for us. So that wristband looks a lot like kind of the material for an Apple Watch, and it has a black slider. And the band is numbered 1 through 10. So how to use this, and there's a guide that comes in this box, is that an individual would say, okay, every day I know I'm going to count at 12:15. I know my baby's pretty active with regularity. So 12:15 is when I'm going to start counting. So that's all they have to know is 12:15. And then as they feel the movement, they're going to slide the band over the number. So there's 1 kick, there's 2 kicks, there's 3 kicks, just until they complete at 10 movements. So at the end of 10 movements, all they have to do is look at the clock and say, okay, it's 12:38. So it took, and I shouldn't have done a math number like that. It's 23 minutes. So they will know it took 23 minutes or whatever it is in order to get to those kicks. And that's all they have to remember to write down. They can write down 10 kicks, 23 minutes on this day. So that is, and this, we've seen this work in a lot of different situations. I had someone comment to me that they worked on a line manufacturing products, and so they couldn't have their phone. And so that was really easy for them to do. It's just, I knew I could look at the clock and I could just start to do that movement. That's a great way. Something that may occur in Mississippi is storms and internet goes out. So this is a great resource for expectant parents in the 3rd trimester to be able to start their counting. So if you are interested in this toolkit, we have several available. We'd love to get them in your hands. And just go ahead and email me and let me know that you'd like a toolkit, and I'll just collect a little bit of information and it'll be out the door on its way to you. All right. So let's move from materials to why does movement matter? Why are we so interested in tracking the movement? Well, we know that movement is a very important way that baby communicates during a pregnancy, before birth. And we know that a change in baby's movements can signify that baby is in distress. We also want to note that this can also be related to maternal health outcomes. So just consider that a change in movement can be an indicator that something is not right. So what we want is for individuals to get to their provider right away, to contact them and let the provider determine what the next steps are. So when should you start counting? You may have heard me start to talk about some of these things, but let me just be really clear about this. ACOG recommends beginning counting at 28 weeks of gestation or 26 weeks if someone is pregnant with multiples or they are high risk. So we know that's when we have an established pattern of movement, and usually the expectant parent is recognizing movements as opposed to gas or something different like that. So what counts as a movement? Well, it's the roll, it's a kick, it's jab, it's everything but hiccups. And hiccups are involuntary movements. So that's not really giving us an idea of how baby is responding in utero because it's involuntary. So how do you kick? Well, this is a little graphic. This can be shared with expectant parents. We have this available as a download. So in the third trimester, so again, that 28 weeks or 26, if you're high risk or with multiples, we'd like for someone to count every day. And let me stress, this is happening at the same time every day for every pregnancy. So just because you learn in one pregnancy how to monitor fetal movements, that doesn't mean that like in the next pregnancies, you're just paying attention to them, because every baby is unique. So we want expectant parents to count the same time every day for every pregnancy and recognize that unique movement. So an individual will need to pick a time when the baby is normally active, time how long it takes to get to 10 movements, and also rate the strength of movement. So you might feel a kick, but you might be thinking to yourself, you know, yes, these kicks have been much stronger in other days. Today it's just kind of a fainter movement. You want to note those changes that you see. And track those, and then contact your provider as you're noticing differences. After a couple days of doing this kind of work, you're going to notice a pattern. An expectant parent is going to notice pattern. And if they're using the app and they're marking this electronically and they're registered, they're going to get a longitudinal graph, so that if something is different, they can look at that and go, yep, I can confirm that I know something is different. We want them to call providers right away if they notice a change in the strength of movements or how long it took baby to get to 10 movements. So what does this look like for expectant parents? Let's see just how easy it is to use these tools.
Whether you're counting on the go,
आराम से घबराइए मत.
your baby's movements matter.
Les mouvements de votre bébé comptent.
Monitor your baby's kicks, pokes, jabs, and rolls once a day.
Todos los días durante el tercer trimestre.
C'est l'occasion de communiquer avec votre bébé et d'apprendre ce qui est normal pour lui.
Bond with your baby.
Crea un vínculo con tu bebé.
सशक्त महसूस करें. Sentez-vous autonome.
Confía en tus instintos.
Trust your instincts.
Ve al hospital de inmediato si los movimientos de tu bebé cambian.
L'application gratuite Count the Kick est disponible dans plus d'une douzaine de langues.
एप्लीकेशन डाउनलोड करें
or visit counttthekicks.org for more ways to count.
देर न करें, आज से ही गिनती शुरू करें.
No tardes, empieza a contar hoy.
Ne tardez pas, commencez à compter aujourd'hui.
Don't delay, start counting today.
So you saw in that video several, I talked about the wristband, you saw the wristband. There's many opportunities to count. So let me get into the app for you and tell you a little bit about this. This app is totally free, 100%. There are no ads that pop up. We're not tracking information and selling that. This app is completely free. It's available in 16 languages, and we are expanding those offerings here very, very shortly. So we'll have even more languages available. So again, we want in the 3rd trimester, every day, the same time, we want parents to count baby's movements. Choose that time when baby is more active and continue to count around the same time each day. So it's really, I just want to highlight, if you have used the app, if you know expectant parents who have used the app, encourage them to register, because we want them to get that longitudinal perspective. If they're not registered, they're just going to see a couple days. We want them to be able to show many days of their movement across the 3rd trimester, and that'll really help a provider understand when movement changes. Like, that empowers that conversation. So sit down, focus on baby's movement, and when you feel the first movement, you hit that big teal foot that you see there. Once that starts, a timer will start a countdown. They're going to tap the footprint every time they feel baby move, push or kick or roll. Once they get to 10 movements, the timer stops. The app says, hey, how strong was that movement? So that's that second little phone in there. And again, this is just a visual representation of how baby has been moving. And I really like, one of my coworkers explained this. Think of this as a data download of parent intuition. So they can download this data and they can share it with their provider, exactly what's going on. So you can also use this app to count for twins, multiple pregnancies. There's baby A and baby B. There you can set daily reminders. There's a free resource that it talks about, let me pull up the screen here. This is local resources. So in your community by zip code, if someone needs to get assistance with housing, if they want to find a food pantry, by zip code, they can do this right from the app. So there's some really great information embedded. You can use this. You saw in the video the different ways they were using the app, the wristband, the paper kick cane chart. You can also go to a library. If someone doesn't have access to their account electronically and they want to count from a library, or someone's home that they're borrowing a computer, they can log into their account and they can do the counting right from the web. So it's very, very easy to do. Just as this, I'll play this little short for us. So this is exactly what the app looks like as somebody is getting into it. You can see there's a menu there where all the resources are. They can set their profile, change their languages, add in contact information. We do ask them where you heard about it. And so we're collecting that kind of information to know for research purposes. And then, okay, here's the privacy settings. I wish this was just a smidge faster. So we're setting the language, and then it'll get over here. There's our timer. Okay, so someone has set this. This is exactly what it looks like in real time. And once that ends, it'll ask them about the strength of movement. And that's it. So there's always some tips that happen. So it's very, very easy to use. Just wanted to highlight just how simple and what the screen looks like. That's why I asked you, if you're a provider working with expectant parents, download the app. I'm not having children at any time in my future, but I know how the app works. I know how to troubleshoot things. So in case somebody asks me, I can share with them just how easy it is to do. So this is, I'll just say this is the final baby safe for this presentation, but not the final baby safe for Count the Kicks. This is baby Mabel. And again, I want to just highlight from Megan, Mabel's mom, the only red flag there was a problem with the pregnancy was the daughter's change in movement. So again, this speaks to the importance of fetal movement monitoring. Okay, so this is the heart of our presentation today for you, is talking about systematic implementation. And as we come here to the end, I just want to highlight a story from a nurse here in Iowa who works at the public health department now, and just why she thinks this is so impactful for healthcare providers.
Before I came to work at the health department, I was a labor and delivery nurse at one of the larger hospitals here in Iowa. So I know firsthand the impact that a stillbirth has on families as well as the providers. And I have also seen the situations where the woman has monitored her baby's fetal movements and has come in because she's noticed a decrease in those movements and that baby has been saved. So I know that it works, and I know that Count the Kicks make a difference in saving the lives of babies. I think anyone that takes care of a pregnant woman should be teaching her about how to monitor her baby's fetal movements. There was one time when a family had a stillbirth delivery, and as I was dressing that baby after it was born, I realized that that little boy was never going to ride a bike, and that that little boy was never going to go to school, and that the parents would never be able to watch their son graduate from school. And even though you try to be professional and a little bit detached just to make it through your day, you can't help but be affected and know how important it is to prevent these stillbirths from happening.
Okay, so what are some ways that you can improve the conversation about stillbirth? Here are some tips that we have. We want to make sure, first of all, that everyone is talking about stillbirth in the same way that we talk about SUIDs. It's really important for us to bring up the topic and to not make any assumptions that people know about stillbirth or that they don't need to know about stillbirth. So being equitable, thinking about that health literacy in the conversation as well. When we avoid assumptions, it's really important to know that just because someone has higher education, that does not mean that they have high health literacy. So we just need to make sure that everyone understands health information and services. And listening and learning, it's really important to ask open-ended questions. This is a skill as a nurse that I used often in my practice. As an educator, I used often. But think about just even those quick conversations that someone is having when they're getting checked in. Tell me about your baby's movements. So you're asking a question that can't be answered with a yes, no, or how is tracking your baby's movements going? So just as you're thinking about just those questions around fetal movement monitoring, make sure that they're open-ended. And then avoiding long, complex explanations. Again, coming from the medical world and the education world, we love to use acronyms, we love to use jargon, but our patients probably don't understand that. So make sure that we are using parent-focused language that's easy to understand. And then be honest. Stillbirth is a risk. SUIDS is a risk. We educate parents about all kinds of risks throughout pregnancy. Think about the education that we give about heart disease during a pregnancy, symptoms of different things that can happen during a pregnancy. We educate about those, and yet many providers are not taking the opportunity to talk about stillbirth and say, this is why fetal movement monitoring is so important. So then the final step can be just checking for understanding and using those open-ended questions just to see how people are taking that in. And so one example of that is, tell me what your plan is to use the Count the Kicks app. Tell me how you plan to monitor fetal movements. Just ask them an open-ended question and make sure that they understood what you were trying to get across in the appointment. And then know that a provider's influence on expectant parents is very strong, and they need to hear from you about why tracking fetal movement is so important. These are some, sample questions that we've heard from providers and kind of that response, but I will let you know that in our app user survey in spring 22, users were asked what kind of messages would influence you to speak up if you noticed a change in your baby's movement. And 87% of our responders said that they would contact the provider about a change if their healthcare provider encouraged them to speak up about a change in movement. And so that's a really important point, is that your influence on expectant parents is very strong, and they need to know from you why that fetal movement is really important. So thinking systematically, one point I want to get across tied to these kinds of questions here And access. Think about the access that your patients have, and think about if you live 2 hours, if your patient lives 2 hours away from a hospital where delivery can happen, what is the message that you want your patients to take away when they come talk to you about fetal movement and they say to you, do you want me to just call you if I notice something's different? If they live 2 hours away, do you want them to call, or do you want them to start to come to the hospital? Because minutes matter when it comes to stillbirth. So just when we're thinking about systematic implementation, think about the population that you work with and the distance that they may have to get access to emergency OB services if it is needed. So here are some other things to think about. Think about discharge paperwork. We can implement Count the Kicks talking points into electronic healthcare systems. Just ask us if you need to see some samples of that. Make sure that your whole team is trained in Count the Kicks. So from the minute that they check in, you could have the little app card, reminder cards at the front desk, medical assistants as they're checking in. At the university where I worked, we had Count the Kicks posters above the scale. And so it was right there where people could see that information, then repeat it in the room. So just have those kind of visual cues for talking, for conversations. And then the after visit summary, we can give you samples of case management forms, intake forms, where healthcare systems have integrated Count the Kicks into that discussion when people are leaving. And procedures. So this is a great place to say to someone, oh, you're waiting to do your glucose test. Well, why don't you download the Count the Kicks apps and start to learn about that? Or why don't you review your Count the Kicks for the past couple weeks and highlight some opportunities that you see there for conversation. That's a really easy thing to do while people are waiting. And then finally, we have an audio recording that you can play, or a waiting room video that you could play in. So just let us know what your needs are. We're happy to provide materials that can help with that. So let me take a quick drink before I get into misconceptions. We're coming around to the end. So we hear a lot of misconceptions. I would encourage you to send any misconceptions to us as you hear them. You're like, oh, that's a good one. I wonder what Count the Kicks would say about that. We'd love to hear that and add it to our frequently asked questions. So here's one that we hear often. My baby should get 10 kicks in 2 hours. Well, the fact is that every baby is different, and there is a recommendation to expect 10 kicks in 2 hours. That's really outdated. So current research indicates that moms should work to understand the normal amount of the normal amount of time, each day it takes their baby to get to 10 movements. Another one that we hear is about Doppler devices. So expectant parents are not trained how to use Doppler devices, and the at-home ones, they don't paint a full picture. So we do not recommend them. And just to highlight that point, here is, this is Jen Hamilton. She's a pretty well-known influencer, and she actually talks about Dopplers as she's talking about the importance of fetal movement monitoring. So let's take a listen.
Did you know that there's an app that can prevent stillbirth? Studies have shown that the most reliable indicator for an intrauterine fetal demise or stillbirth is a change or decrease in fetal movement. Getting to know your baby's movements and letting your doctor know if you have any changes is a great way to protect your baby. You don't need an at-home Doppler, and in fact, I would highly discourage you from buying one, because sometimes what happens is you can notice a change in your baby's movements, and you can put on the Doppler and hear a heart rate and be like, whew, everything's fine. And if you were put on a monitor where we could see what your baby's doing, we would see fetal distress. This is a baby that's doing great. This is a baby that might not be doing great, and this is the baby that's definitely not doing great. But guess what? Every single one of them has a heart rate around 150. And with just hearing a Doppler, we don't know which one of these is your baby. There's a free app that you can download called Count the Kicks. It is a way that you can monitor your baby's movements, and it'll help you figure out if you might need to go get medical attention. I don't work for Count the Kicks. I get $0 for telling you about this. I just think that this is genius. They were able to decrease Iowa's stillbirth rate by 32% in the first 10 years of the Count the Kicks campaign. So please, take a few minutes each day and just pay attention to to what your baby's doing. And if your baby's doing something wonky that they haven't normally done before, come see us. We would so much rather you come in, we monitor your baby, we maybe do an ultrasound, and we let you know that your baby's doing okay, than for you to not come in and your baby not be okay. You aren't bothering us, okay? We want you to come in. That's what we're here for.
Okay, so as we are finishing up, I just want to take the opportunity to go through some next steps that may be really important for you in the space that you're working in. So 1, familiarize yourself with the app and practice. 2, order Count the Kicks material. So we've done that today. And remember, we are giving away 2 $25 Amazon gift cards. We want those out the door today. So place your order with us today, and make sure that someone in your office is paying attention to those materials. If you get down on those at a glance brochures that you ordered, make sure that you are communicating so that you get more in place. And then take time to educate. Make sure that every patient in the 3rd trimester is hearing this conversation. Use those open-ended questions. Tell me how fetal movement monitoring is going. Tell me how you feel when you are spending time tracking movements. Just use those open-ended questions. 4, make sure that the entire staff knows about this campaign and the importance of tracking fetal movement monitoring. I can't tell you how many times I've heard about a conversation someone had with an expectant parent that just seems like they weren't a provider, they weren't a medical assistant, but they had the conversation because they knew. And so I think that's really that really highlights that it's important to have everybody on the same page as far as talking about this. And then debunk those misconceptions, encourage speaking up. Again, this campaign is really to empower expectant parents. So let them know, hey, if you notice something's wrong, you know your body, you know your baby, and you can advocate for making sure that everything is okay. And then again, and this is what I was talking about with systematic implementation, remember that hours and minutes matter. So educate patients and your staff on how to expedite concerns about movement. So again, if they're in a rural area or if they're impacted by their ability to access a healthcare system, have that conversation before it's too late. Make sure that your patients know how to access care. So as we are done for the day, I just want to highlight again, the resources, the materials. This is the best way for us to get the word out, spread it far and spread it wide. And then if you are interested in continuing education units, if you're somebody who wants to get into some more of this research, we welcome you to scan this QR code to take a CE training. To learn just a little bit more about the research that's there. We have tons of research and evidence on our website. We'd love to share that information with you. And then in Mississippi, we do have ambassadors. So what are ambassadors? They, across the United States, these are individuals who are passionate about their personal experiences with stillbirth. They are completely voluntary. So they're doing the work. They can come to baby showers that you have. They can speak with the media. They can be present at medical conferences. So just there's lots of opportunities to engage with them. So let us know if you need to be in contact, or you can go to the website, and here are the 2 that you have in Mississippi. Wonderful advocates, Grace and Tony are for us. So just know that those are available to you. And then finally, I'm going to open this up to questions. So feel free to put questions in the chat if you'd like to ask me something today. But follow us on social media. If you want to know more about Healthy Birthday, about the legislation that we are involved in, the advocacy work that we're doing, the Healthy Birthday channel is a wonderful resource for that. Count the Kicks, social media is a little more focused on expectant parents, and we have an awesome social media manager who's making content and making connections with individuals. And then finally, an opportunity to get our newsletter and to hear about what's new. So I know that this has been a pretty fast and furious 50 minutes with me today, but I'd like to give you an opportunity to ask questions. If there's something you're wondering about this, feel free to put it in the chat. I will make sure we stop recording so people can go about their day. Let me get over here, but